Welcome back to the Hotcast. We're doing a deep dive today
Yeah.
into some pretty interesting news coming out of Japan.
Oh, yeah.
It seems like they're having a pretty intense flu season, like making headlines kind of intense.
Wow. Okay.
And it's happening a lot earlier than people expected.
Huh.
So I've got some reports here from NHK World Japan
Okay.
and Nippon.com.
All right.
All about this situation.
Oh.
And luckily, I've got our expert here to break it all down with me.
Well, it's definitely not typical, that's for sure. Usually Japan sees, the peak flu activity kind of between late January and February.
Yeah.
But this year, they're already way past those levels, like significantly.
Yeah, the numbers are actually pretty wild.
Really?
In the last week of December, just last month,
Mhm.
Japan had over 317,000 flu cases.
Oh.
Which, just to put that in perspective,
Yeah.
that's the highest weekly count since they started keeping track back in 1999.
That's a long time.
But-
So yeah, that's significant.
And it's not like it's just spread evenly across the whole country either.
Oh, really?
The reports are saying Kyushu,
Okay.
the southwestern region of Japan,
Mm-hmm.
it's being hit really hard. Some prefectures there are seeing like over 90 cases
Wow.
per medical institution,
Per medical institution.
which is more than 3 times their warning level.
Yeah, that's pretty alarming.
So record-breaking numbers, concentrated in certain areas. What's going on? Is there like a super flu going around?
Well, I mean, the specific strain is definitely part of it, but it's more complicated than that.
Okay.
One thing the reports talk about a lot is the COVID-19 pandemic.
Right.
And, the effects of that are still kind of lingering.
That makes sense. I mean, during the pandemic, flu transmission went down everywhere.
Yeah.
And a lot of experts said it was because of all the safety measures, like masking and social distancing.
Exactly. Those measures, I mean, they definitely helped with COVID,
Of course.
but they also kind of accidentally suppressed the flu, too. But now that things are more relaxed and people are traveling internationally again, the flu's got more chances to spread.
So are you saying that because people weren't getting the flu as much, their overall immunity went down, and now that's why we're seeing this huge surge?
Yeah, that's a big part of it, herd immunity and all that.
Right.
Fewer people getting sick means fewer people are immune.
Like hitting the reset button on the flu cycle, almost?
Exactly.
Okay, so we've got lower immunity, people are back to their old habits. That explains the huge numbers. But, what does it mean for Japan in practical terms?
Well, one of the biggest and most immediate impacts is on their healthcare system.
Uh-oh.
The reports are talking about hospitals and clinics, especially in Tokyo and Gifu,
Yeah.
being totally overcrowded. They're just overwhelmed with all these flu patients.
That sounds rough for both the healthcare workers and the patients. Are they doing anything different to try and manage it all?
Yeah, actually they are. One thing that caught my eye was this drive-through testing they're doing for the flu.
Drive-through. Like for burgers.
Yeah, exactly. Except, for flu tests, it's supposed to take some pressure off the hospitals and clinics.
That's actually a pretty clever idea.
Yeah.
Keeps people out of the waiting rooms, maybe less potential exposure there, and it's probably faster for everyone.
Right. It's a good example of how being flexible and thinking outside the box can really help in these situations.
I wonder if that's something other countries could do too. But anyway, that's just one way Japan is handling this massive flu season. We'll get into more detail after the break, including the concerns about complications and if there's enough vaccine to go around. But first, a quick reminder to subscribe to the Hotcast channel for more deep dives into all sorts of interesting stuff, just like this.
Yeah, it really shows how we need to be ready for anything when it comes to health. And speaking of being ready, one of the more worrying things about this outbreak is that there are more severe cases, especially in kids.
Right. The reports mention that there's been a tragic rise in these cases of influenza encephalitis.
Yeah.
At this hospital, Shizuoka Children's Hospital.
Right.
Can you explain what that is for anyone listening who might not know?
Sure. So influenza encephalitis happens when the flu virus causes basically inflammation in the brain.
Oh, wow.
It can get serious really fast, and it starts with symptoms like a really high fever and then can lead to neurological problems like seizures, even passing out.
That's really scary. For both the kids and their parents, I can't imagine.
Yeah.
It really shows how important it is to know just how serious the flu can be, especially for, certain groups who are more vulnerable.
Absolutely.
So are they doing anything specific to deal with this complication?
Well, the first thing is vaccination.
Right.
But one of the things reports say is that a lot of the kids who ended up in the hospital with influenza encephalitis hadn't had their flu shot.
Oh, really?
which is really concerning.
Yeah, that's a big deal. It shows how important those vaccines are,
Yeah.
not just for yourself, but for the people around you who might be more at risk.
Exactly. I mean, it's all about herd immunity, right? The more people are vaccinated, the less the virus can spread.
And that helps protect everyone, even the people who can't get vaccinated for whatever reason.
Yeah.
So vaccines are important. But what about treatment? What if someone gets sick? Are there any good antivirals?
There is. There's a generic antiviral, oseltamivir. It's pretty effective against the flu.
Okay, good.
But, and this is another thing the reports talk about, Japan is actually having a shortage of this medication right now.
Oh, no, really? A shortage? What happened?
Seems like the company that makes it, they're having problems with their supply chain or something.
Oh, okay.
So there's just not enough of the drug, especially the kinds that are usually given to kids, like the syrup.
That's really worrying with so many cases and the potential for things to get really serious.
Yeah.
When do they think it'll be back in stock?
The reports say the company is working on it. They think they'll be able to start sending out the syrup again later this month, and the capsules should be available again by early February.
Okay, so hopefully that's soon enough. It's a good reminder that even the medicines we think we can always get can be affected by things we don't expect. It's important to have backup plans and make sure the supply chain is strong.
Absolutely. And it's a lesson for other countries, too. You need to have different ways of getting essential medications and be prepared for shortages just in case.
It's like we can all learn from each other's experiences, right? And maybe do a better job of working together on these global health challenges. But we've been talking a lot about Japan, and this is a global issue. So as other countries are getting back to normal after the pandemic, what can they learn from what's happening in Japan?
That's a great question. I think what's happening in Japan now could be a sign of things to come for other countries, especially as they stop doing all the COVID precautions and go back to like pre-pandemic levels of travel and socializing.
So it's not just about helping Japan now, but about using this as an example for everyone else to get ready.
Exactly. We need to be thinking about what might happen next and taking steps to prepare for it.
So what can other countries do to get ready?
Well, one thing is to have really good systems for tracking diseases and watching for new trends. Japan has been really good at keeping records, all the way back to 1999.
Wow.
That's helped them understand how bad this outbreak is and figure out what to do.
So investing in public health and data collection is important, not just during an emergency, but all the time.
Right. Another thing is being able to communicate clearly and honestly with the public. People need to know what the risks are and what to do.
So they can make informed decisions.
Exactly. And of course, we can't forget about vaccination. It's so important for protecting everyone.
It's like we're all in this together,
Yeah.
and we need to look after each other. And what's happening in Japan is a reminder that we need to be paying attention and working together to be prepared for whatever comes next.
Right, exactly.
Welcome back to the Hotcast. We've been looking closely at this record-breaking flu season in Japan, trying to understand what caused it and how it's impacting their healthcare system.
Yeah, and we've talked about those concerning cases, the more serious ones,
Right.
especially in kids, and then that whole shortage of that antiviral medication. What was it called?
Oseltamivir.
Oh, yeah, oseltamivir.
Yeah, it's definitely been interesting to see how complex it is to manage, a health crisis like this, especially with everything changing so fast in the world.
Right, exactly. But there have been some bright spots too, right? Like some signs of resilience and some pretty innovative ideas coming out of it.
For sure. I mean, think about those drive-through testing centers.
Oh, yeah, that was a good one.
That's a perfect example of adapting and like coming up with new solutions, right?
Totally.
Really shows how creative and adaptable those healthcare workers and public health officials are over there.
Yeah, they've had to be. Makes you think, though, what can other countries learn from all this?
That's the big question, isn't it? I mean, Japan's situation is like a wake-up call.
Yeah.
These infectious diseases, they haven't just disappeared.
We might be changing our behavior and easing up on those public health measures, but that also changes how vulnerable we are.
So it's not just about dealing with what's happening right now, but also about being ready for what might come next.
Exactly. And that means having really good systems for keeping track of these diseases and noticing any new patterns. Like Japan's been really good at that. They've been keeping records since 1999. So they have this really clear picture of how bad it is and what they're dealing with. That's helped them a lot.
So investing in public health and data, that's got to be a priority all the time, not just when there's a problem.
Absolutely. And, being able to communicate clearly and honestly with people. That's huge, too. They need to know what's going on, what the risks are, what they should be doing.
Right, so they can make good choices for themselves and their families.
Exactly. And then, of course, we can't forget about vaccines.
Always important.
They're just so crucial for protecting everyone.
Yeah, and the thinking about those unvaccinated kids who got really sick, that's a powerful reminder that getting vaccinated isn't just about protecting yourself.
Right.
It's about protecting everyone around you, too.
It really is.
It's like we were saying before, we're all in this together, and we have to look out for each other.
Couldn't agree more.
And what's going on in Japan, it shows us that we got to be paying attention, working together, being ready for whatever comes our way.
Well said.
It's also pretty amazing to see how dedicated and resourceful everyone is over there dealing with this flu season. It gives you hope,
Yeah.
Like, we can figure this out. We can handle these challenges and build a healthier future.
I agree. There's always a way forward.
Absolutely.
Mhm.
And for everyone listening, remember, knowledge is power. Stay informed about the risks, listen to the experts, and take care of yourselves and your communities.
Great advice.
And hey, if you want to dive deeper into more fascinating topics like this one, make sure you check out the Hotcast channel. We're always exploring new ideas and trying to make sense of the world.
It's a wild world out there.
Thanks for joining us for this deep dive into Japan's flu surge. Hope you found it interesting and helpful.
Thanks for having me.
And thank you for listening to the Hotcast.